Hello, this is Dr. Matson again. I'm going to go through some of the theories and research on operant conditioning in this presentation. A few of the ideas that we'll cover in this PowerPoint presentation is the role of the response and the reinforcer, as well as how do we predict what the reinforcer will be, and behavioral economics. I'll also be covering some different experiments that were done with a few different theorists as well. Just to let you know, there's different links that you'll see for YouTube videos. I will post all of the links that are in this PowerPoint presentation under like the comments section in once it's posted on YouTube. So to go over some of Tellman and Hansik's latent learning experiment, this was a pretty famous, well-known experiment that was done in the 1930s. They demonstrated that reinforcement is not strictly necessary for learning, but it's crucial for the performance of a learned behavior. They trained rats in a maze under 3 conditions. The first one being the reinforced group. Rats received food at the end of the maze from the beginning of the experiment. The non-reinforced group, which is the rats that received no food throughout the experiment. And then the latent learning group, which is rats initially received no food for 10 days, but on the 11th day, food was introduced. The latent learning group showed that rats were learning the maze without reinforcement, as they performed almost as well as the reinforced group once the food was introduced. This demonstrated that learning occurred without reinforcement, which is called latent learning, but reinforcement was necessary for the expression or performance of that learning. Reinforcement is not required for learning a new response, as we see with the rats who learn the maze without needing food. However, reinforcement is necessary for the performance or the demonstration of the learned behavior. In operant conditioning, we see that reinforcement strengthens the likelihood that a response will be performed in the future. And so in traditional operant conditioning, reinforcement is key to motivating an individual to perform a desired behavior repeatedly. This is making it essential as part of the behavior modification. So let's first answer this question. It says, can reinforcement control visceral responses? The answer to that is yes. Reinforcement can control visceral responses, as demonstrated in this research by Miller and Decara. This work shows that operant conditioning can extend beyond voluntary behaviors to influence involuntary bodily functions, such as heart rate and other automatic responses. So in the 60s, Neil Miller and Leo Decara conducted experiments that demonstrated operant conditioning of the autonomic visceral responses. This is challenging the long-held view that these responses could not be controlled through reinforcement. So rats were paralyzed with curare. In their experiments, rats were injected with the drug that induces temporary paralysis, preventing any movement or voluntary behavior. Despite the paralysis, visceral responses in the rats, such as heart rate, could be conditioned using reinforcement. And then if we look at electrical stimulation of the brain, instead of using traditional reinforcers like food, the researchers used the ESB, electrical stimulation of the brain, particularly targeting reward centers like the hypothalamus. This acted as a highly motivating reinforcer. By delivering ESB, contingent on changes in heart rate, they were able to reinforce increases or decreases in the rats' heart rates depending on the conditioning procedure. Miller and Decara's experiments went beyond heart rate and demonstrated that other visceral responses, such as blood pressure, as well as intestinal contractions, could also be conditioned using reinforcement. These findings expanded their understanding of operant conditioning to also include the modification of the autonomic processes, which were previously thought to be voluntary control. Miller's research laid the foundation for biofeedback, which is a therapeutic technique that helps individuals gain control over involuntary physiological functions by providing real-time feedback. So for the tension headaches, biofeedback has been successfully used to help patients control muscle tension, and it reduces the frequency and intensity of tension headaches by providing feedback on physiological signals like muscle activity. The muscular paralysis biofeedback has been employed to help patients regain partial control over muscle groups by reinforcing small voluntary movements or changes in muscle tone, improving motor function. Neurofeedback is a specific type of biofeedback where individuals learn to regulate brainwave activity. And so this technique is often used in the treatment of conditions like ADHD, anxiety, some seizure disorders. By providing feedback on brain activity, individuals can learn to reinforce more desirable brainwave patterns. So their research demonstrated that reinforcement could indeed control visceral responses, leading to a broader understanding of operant conditioning, which has paved the way for practical applications like the biofeedback and the neurofeedback, which allows individuals to gain control over previously thought involuntary physiological functions, as well as improving health outcomes in various conditions. So, transsituationality is the concept that a reinforcer effective in one situation will also serve as a reinforcer in all other situations. This idea suggests that once something's been established as a reinforcer, it should work across different contexts, reinforcing a variety of behaviors. The principle stems from the work of Skinner, who focused on generalized reinforcers such as money or praise, which are very effective in many situations. However, some reinforcers may work across multiple contexts. This is not true universally. There are several counter examples to consider where a reinforcer in one situation may not function as a reinforcer in another. And so we can look at this through like social contexts, like praise. Praise from a teacher might be an effective reinforcer for a child in a classroom setting, but could fail as a reinforcer in social situations with peers. In some cases, receiving praise in a peer group might even lead to social rejection, so that then it reduces its reinforcing value. I mentioned money, so cultural or environmental differences is where we would look at money. So money is a generalized reinforcer in many societies because it can be exchanged for various goods or services, right? But in certain cultural or isolated environments, money holds no values. It would not serve as an effective reinforcer, and so the value of money as a reinforcer is context dependent. If individuals can have varying preferences based on the specific situation or the type of task, for example, music might serve as a reinforcer for studying or relaxing, but it could also be a distraction during tasks that require intense focus. So it's not necessarily reinforcing in that situation. So in transsituationality, the principle works for some generalized reinforcers, but these numerous counterexamples that I discussed, reinforcers do not carry over. And so that's something that we want to keep in mind, that, reinforcement is often context dependent rather than universally applicable. So David Premack in 1965 came up with the Premack principle that suggests that more probable behaviors or high probability can be used as reinforcers for less probable behaviors or low probability. Often phrased as if you do X, you can do Y, right? X is the low behavior, Y is the high behavior. There's a behavior hierarchy to follow. So every person has a unique ranking of behaviors that's based on preferences or likelihood. High probability behaviors are activities that are naturally enjoyable or frequently performed. Low probability behaviors are tasks that are less desirable or frequently avoided. And so the application process, by offering access to a preferred behavior or reward that's contingent upon the completion of a less preferred behavior, then the likelihood of performing that less preferred task increases. So we see this a lot in classrooms, therapy, parenting, as well as personal productivity too. In parenting, it's like first clean your room, then you can play video games. The cleaning your room is the low probability, the playing the video games is the high probability. In education, if you finish your math homework, you can go outside for recess. Math homework low, recess high. Personal motivation, if I complete my workout, which is the low side, I'll treat myself to watching my favorite show, high side. Behavioral control, it gives individuals more control over their actions as they know that completing a less desired task will lead to a reward. And with positive reinforcement strategy, it encourages the development of productive habits by linking enjoyable activity with tasks that need to be done. So, if you're going to use the PREMAC principle, you want to identify preferences. So make a clear list of high and low probability behaviors. You want to set clear contingencies. Make sure that the individual knows exactly what must be done before they can engage in the preferred activity. And remember that consistency is key. So use the principle consistently to build a reliable behavior reward connection. And then you also have to adjust for individual needs. What is a high probability behavior for one may not be the same for another. So you have to personalize the approach, right? That can be essential. So functional analysis, this is a method that we use in behavioral psychology to identify the causes and reinforcers of specific behaviors, particularly the maladaptive or the bizarre behaviors. By analyzing the function of a behavior, professionals can design effective interventions to change or reduce problematic actions. So this approach is commonly applied in the context of behavioral disorders, self-injury, and other challenging behaviors. So why do we do bizarre or why do bizarre or maladaptive behaviors occur? Every behavior serves as a function or it has a purpose, even the maladaptive or bizarre ones. Functional analysis seeks to understand why these behaviors occur by identifying what reinforces them. The behavior may be a way for the individual to communicate a need or to respond to certain environmental factors. Behaviors persist because they're reinforced, whether positively or negatively. The reinforcement might be something tangible, social, or even sensory like automatic, but understanding the reinforcer helps to shape or alter the behavior. So let's go through this example of the boy's self-injurious behavior. In this example, a boy exhibits SIB, self-injurious behavior, such as hitting or biting himself. The functional analysis aims to determine the specific cause of this behavior by examining possible reinforcers. So escaping from an unwanted task, the child might engage in self-injury to avoid or escape a task or a situation that they find aversive, such as schoolwork, chores, maybe social interaction. In this case, the behavior functions as a negative reinforcement, allowing the child to escape or delay the unwanted task. Self-injury might result in gaining access to tangible rewards such as toys, food, or other preferred items. If a child receives these items after self-injuring, then the behavior is positively reinforced. If we're looking at attention, we might see the SIB as a way to gain attention from others, whether positive, such as comfort, negative, such as scolding. It's giving that child attention. If caregivers or peers respond to the behavior, it reinforces the action. The automatic reinforcement sometimes occurs because it produces sensory stimulation or a feeling that the child finds comforting or desirable. This is common in individuals with developmental disabilities or sensory processing disorders. But in this case with the boy, and the SIBs, after analyzing the triggers and consequences, the functional analysis suggests that the boy's self-injurious behavior is reinforced by escaping from an unwanted task, meaning that the boy engages in self-injury because the task or demand is removed, which is reinforcing the behavior. So to treat this, right, if we want to address this behavior, we need a treatment plan. This might involve escape extinction, where the child is no longer allowed to escape the task by engaging in self-injury. This is done carefully to ensure that the behavior is not reinforced, but we're still providing support for completing tasks. The child could be taught more appropriate ways to request a break or communicate discomfort, maybe using verbal signs, verbal requests, a break card, something like that. This promotes a healthier way to achieve the same outcome without resorting to self-harm. We could use DRO, which is differential reinforcement of other behaviors. This involves reinforcing any other behavior that the child engages in besides the self-injury. Over time, this reduces the frequency of the maladaptive behavior while promoting positive alternatives. And if we're going to tolerate the task, we gradually increase the abilities of the child to tolerate the task using positive reinforcement for small accomplishments first. This can help reduce the need to escape from the situation altogether. And we are going to wrap up here with behavioral economics and look a little bit with drug abuse. So, behavioral economics applies economic principles to understand and influence behavior, especially in contexts such as drug abuse. It combines insights from psychology as well as economics to explore how individuals make decisions about substance use, considering factors like cost, maybe availability, reinforcement. So first we look at supply and demand. So drug consumption is influenced by the availability or supply of the drug and the demand for it. Behavioral economics examines how changes in price, access, and substitutes can influence drug behavior. The elasticity of demand is how responsive drug users are to the changes in price. So when the price of a drug increases, demand may decrease if users can no longer afford or justify the cost, particularly when alternatives are available. We have this fixed ratio schedule, FR. This refers to the requirement of performing a certain number of responses, like pressing a lever or something like that to receive a drug. As the number of required responses increases, so the cost of obtaining the drug goes up, then the demand for the drug increases. If there's a decreased demand, this is similar to human behavior, and animals show less interest in obtaining a drug as the cost, effort, or price increases, but providing a controlled model for studying addiction and reinforcement is possible. Introducing alternative non-drug reinforcers such as social interaction or food, this can reduce the likelihood that an animal will seek out the drug. It suggests that the presence of alternatives can also diminish the appeal of drug use. If we look at price sensitivity in drug use or the demand, for drugs decreasing as price increases, human studies mirror animal research. And so when the cost of a drug rises, either through legal restrictions or increased financial cost or other barriers, people tend to reduce consumption. Methadone, as an imperfect substitute for heroin, we see, serves as a substitute for the heroin addiction. However, it's imperfect substitute because it does not completely replicate the effects of heroin, but it can, however, reduce the harmful effects of the drug and help manage the addiction. Reducing the supply of drugs through law enforcement, regulation, even intervention, increases the cost of obtaining the drug, which also decreases consumption. However, this alone is not usually sufficient without additional supports. By providing alternative reinforcers like employment, hobbies, social support, counseling, individuals may be less motivated to seek out drugs. Offering positive reinforcement through healthier choices can shift behavior away from drug dependence. If we combine reducing drug availability with an increased access to alternatives, like maybe vocational training, therapy, community programs, this can be more effective in treating addiction than solely just reducing the supply. So we want to keep in mind that behavioral economics provides a useful framework for understanding drug abuse and informing public policy. By manipulating the price of drugs, altering their availability, and increasing the availability of alternative reinforcers, that way we can better understand and address addictive behaviors. I hope you enjoyed this brief presentation and have a lovely day. This is Dr. Mattson.